Hi, my name is Dr Somji. I'm a cosmetic surgeon here at DrMediSpa. Today we're going to talk about chin fillers and jawline fillers. Jawline fillers have gained a lot of publicity recently. It's also something that we've been performing for a number of years. It involves injection of local anesthetic and hyaluronic acid just into the jawline area. It actually acts to structure and contour the jaw so that if you have any rippling of the jawline and also any jowls, it can mask this area too. If injected correctly, you can also give a little bit of lift to the side of the face too. So there are a number of different patients that have jawline fillers. One is the individual with a little bit of starting of the jowl, which we can mask. And two is an individual that also wants a little bit of contour to the jawline as well. I always say to be careful about jawline fillers and make sure that we think about the whole face. So before we even proceed to injection in this area, we make sure that if you're a female, that the cheeks are slightly wider than the jawline and that we're not injecting fillers to make you more masculine. We're making sure that we retain your nice female shape. And if you're a male, we will also probably do the opposite. So within the assessment, this is the most important thing. Once we've actually established how much we're going to inject and where we're going to inject, we proceed to injection in a minimally invasive way. I use a cannula to gently inject filler across this jawline, and it's also quite a lot more comfortable than traditional methods where we inject with needle. It involves very little downtime, and you can also get back to your daily activities quite quickly. Sometimes in the jawline area, a second session is generally required because it's such a large area. And we do see you in 2 weeks to make sure that everything's settled down before re-injection. Moving on to chin fillers. This is sometimes actually performed in conjunction with jawline. In terms of aging, we do inject chin fillers to make sure that we alleviate these lines that sit from the side of the mouth. They're called marionette lines. And as we age, the chin also comes in slightly and also upwards. The injection of fillers in this area can lift the chin out and also support the sides of the mouth too. If we're performing jawline contouring, then we also want to carry on that nice contour around the chin area too. I like injecting the chin area because it balances up the face. So if an individual has injected lip filler, it's always important to look at the distances between the lower lip and the bottom of the chin, as well as the upper lip and also the tip of the nose. It needs to be in about 1/3 to a 2/3 ratio to make sure that everything keeps looking natural. So if you've injected a lip and you've got a slightly smaller chin, then you can be at risk of looking unnatural. And this is why sometimes I add a little bit of volume to the lower part of the chin to make sure that everything flows nicely and you still look like you've been enhanced, but not like you've had any work done.